While working as a CNA, a problem I encountered was miscommunication between my manager and our front desk receptionist. My manager needed some new charts because the ones that we had weren't working very well, and she wasn't familiar with how to use Excel, so she asked our receptionist to do it for her. However, she didn't understand what my manager needed. So I would show up to work and we would either have incomplete charts or no charts at all. So my coworkers and I were just scribbling in our patient care notes on the margins of paper. This was frustrating because I felt that I couldn't effectively chart the information that my manager wanted. I decided that I was the perfect middleman for this problem because I was familiar with how to use Excel, and I also had a much better understanding of what my manager was looking for. So one day I stayed a couple hours after work and I sat down with my manager and we drew up some new charts together. This completely eliminated the communication gap because she was right there and could tell me exactly what she needed, but I could also provide her with feedback. This effort for clear communication will serve me well as a nurse because communication between team members is crucial, because everyone needs to be aware of what the patient's needs are and what's going on, so then we can all work together to effectively meet those needs. Also, being action-oriented will be an asset because oftentimes as nurses, we don't have time to wait for other people to solve our problems. So stepping up and offering our skills will help us solve those problems quicker, and then our patients aren't waiting for us to find solutions. As far as my teamwork skills go, being team captain of my high school volleyball team, I learned the importance of when to lead and when to follow. One of the reasons why I was nominated to be team captain was because I was good at getting our team fired up and super excited, and I also made it a point to be super supportive of my teammates and tell them what they were doing well, and then my teammates also followed that example, and so the result was we had a great team environment. On the flip side, I was a passer for our team, but I was not the best passer on the team. So sometimes it was necessary for me to step aside and let my teammate, who was a phenomenal passer, step in and either take the ball for me or offer me advice, and I would follow her in that way. As a nurse, I will have to do the same. Sometimes I will need to step up and offer my skills and lead the way, and other times I will need to follow others because we all have different skills and abilities and strengths. And so if we're utilizing everyone's strengths in these ways, we are putting everyone's best foot forward to effectively care for our patients and give them the highest level of care possible.